one issue that many Kratom quitters have is PAWS.
Oh, gosh, yes.
Yes, and that was one of your publications in the Journal of Addiction Medicine in 2023. Could you give an overview of PAWS?
We don't understand it. I'm going to stop there for comedic effect. Hopefully someone found that funny. Okay, let's actually go into it. Okay, so it stands for post-acute withdrawal syndrome. There's loads of synonyms. Protracted withdrawal, subacute withdrawal. Here's how I think about it. Okay, so drugs and alcohol have a profound effect on the brain chemistry. Sometimes it's fairly clean. Alcohol affects the neurotransmitter GABA and the neurotransmitter glutamate. We know exactly how alcohol works. Kratom is messy. Kratom affects multiple receptors. It affects the enzyme cyclooxygenase. It has a stimulant-like effect. It has an opioid-like effect. It actually affects the alpha-2 receptor. Kratom is messy. Now, the other thing is that the prolonged exposure to substances secondarily affects other systems in the brain. So there's what's called a substance-induced mood disorder, which is where you can get depression because of your addiction. Or you can get a substance-induced psychotic disorder, where you're hallucinating because of the substance. In other words, the substance has a very specific lane it affects in the brain, but it's almost like you're driving through snow. The snow gets pushed to the sides. That lane changes other systems in the brain secondarily. And so withdrawal is coming off of the substance. Post-acute withdrawal is the other systems in the brain trying to correct themselves. And this goes back to, again, it takes up to 2 years for the brain to fully heal. And part of that is learning emotional resilience, learning coping strategies, understanding mindfulness about when you're feeling what you're feeling, and then letting those other secondary systems heal. For example, the serotonin system regulates our mood. That's an oversimplification, but think about selective serotonin reuptake inhibitors like Prozac or Lexapro. A lot of times, what we do in post-acute withdrawal syndrome is we use psychiatric medication to make those other systems work better. So I'll pick on you again, Charlie. You're coming off of Kratom, we weaned you off of Suboxone, and you're horribly depressed and can't sleep. That's the rest of your brain systems trying to figure themselves out. We might put you on a sedating antidepressant to help you sleep at night and help that system get better faster. Now, there are a couple of things that we know make PAWS get better faster. Number one is exercise. Okay? Exercise is very important to heal various systems in the brain, including the serotonin system and the reward system, which is the dopamine system. Okay? Other things, good sleep. And that's very hard for many people in early recovery. A non-addictive sleep aid can be helpful. It could be something like melatonin. It could be something like trazodone. I would definitely stay away from the benzos because those are addictive and will start to have ripple effects in those other systems. Okay? Positive human interaction. That's where mutual support groups like Alcoholics Anonymous come from. If there are positive communities online around getting sober from Kratom, someone giving you a virtual high five on your 30-day sober day, that's positive human interaction that helps healing from post-acute withdrawal syndrome. And then it's just sometimes medicines targeting symptoms. If you're super anxious, we might give you a non-addictive anxiety med while you work with a therapist to address your anxiety. It's essentially targeting symptoms with non-addictive medication, exercise, therapy, and working on positive human connection and good sleep.